All right. Hello, everyone, and thank you for being part of this presentation today. I get to talk about the fun part. We've had a lot of discussions around ACEs and the problems that are there. I'm going to share a little bit of the data around why those first 6 years are so important, but then I'm going to be able to get into what are we going to do about it? What is the plan for our area? So I am Angel Rhodes. I've had a promotion since we turned in all of the materials. So I am now the Vice President for Future Ready Columbus. And Future Ready is a collective impact organization. Let's see here. There. Future Ready is a collective impact organization. We are a nonprofit and we are focused on the first 5 years of life from prenatal to kindergarten entry, which I guess that's through age 5. And we are looking at everything that impacts a child's ability to be ready for kindergarten. Our number one goal, every child ready for kindergarten by 2030. So I'm going to skip over these first 2 slides here because Dr. Wade did a really awesome job, which did he just pull anybody's heart as much as he did mine? Yes, absolutely. So right here, these are the Kaiser Permanente 1998. 10 original adverse childhood experiences. And these are the expanded ACEs that were brought about in the 2012-2013 Philadelphia ACE study. So let's look at Ohio stats. A little bit like what we were just hearing, they are a little different than some of the national pieces that we were hearing. Ohio ranks 46th in the nation for children experiencing childhood trauma. And not 46 as in 50 is the best and they have the least. We are 46 at the bottom. 30% of Ohio children have had 3 or more adverse childhood experiences, which puts them at a much higher risk for those long-term negative effects. And inequities are impacting our Black and Hispanic children as they are at a much higher risk of experiencing an ACE than their white peers. So I want to think about all of this and put it into context around brain development. And I love this little video that is from the Harvard University Center on the developing child.
A child's experiences during the earliest years of life have a lasting impact on the architecture of the developing brain. Genes provide the basic blueprint, but experiences shape the process that determines whether a child's brain will provide a strong or weak foundation for all future learning, behavior, and health. During this important period of brain development, billions of brain cells called neurons send electrical signals to communicate with each other. These connections form circuits that become the basic foundation of brain architecture. Circuits and connections proliferate at a rapid pace and are reinforced through repeated use. Our experiences and environment dictate which circuits and connections get more use. Connections that are used more grow stronger and more permanent. Meanwhile, connections that are used less fade away through a normal process called pruning. Well-used circuits create lightning-fast pathways for neural signals to travel across regions of the brain. Simple circuits form first, providing a foundation for more complex circuits to build on later. Through this process, neurons form strong circuits and connections for emotions, motor skills, behavioral control, logic, language, and memory during the early critical period of development. With repeated use, these circuits become more efficient and connect to other areas of the brain more rapidly. While they originate in specific areas of the brain, the circuits are interconnected. You can't have one type of skill without the others to support it. Like building a house, everything is connected, and what comes first forms a foundation for all that comes later.
Okay, so think about that. The first 6 years is where the largest amount of brain development happens. By the time you are 3 years old, 80% of your brain was developed. By the time you enter kindergarten, 90% of the brain is developed. So when we start thinking about all of these, let's go back to that one piece that was in there. Notice emotion is at the bottom of there. That is the little ball, bottom of the brain. Here is your spinal cord. And remember, they said the areas that get used more grow and get lightning speed connection. The areas that don't prune away. So when a child is experiencing trauma, that portion is going, that fight, flight, or freeze that we now have in there is getting bigger and bigger to the detriment of all of the other areas that helps that child to be ready for kindergarten. Trauma impacts brain development in a very, very concerning way. So let's start thinking about kindergarten readiness. Let's think about why it's even important. First of all, we have a crisis in Franklin County when we're talking about children being ready for kindergarten. Only 40% of all children are ready for kindergarten when they enter. And this is assessed on the Kindergarten Readiness Assessment, which is a assessment that children take when they first enter kindergarten. Now, if we start delving into that data, racial and economic disparities are having an even more devastating impact on our children. And the research is very clear that the Kindergarten Readiness Assessment predicts how children will do on the third grade reading guarantee. That third grade reading guarantee predicts a whole host of lifelong outcomes. A lot of people are surprised to find out that Ohio and other states use their third grade reading guarantee to predict the number of prison beds they are going to need in the future. That is how strong that level of data is. So 90% of that brain developed, we move into kindergarten readiness. A child that is not demonstrating kindergarten readiness when they move into kindergarten has a host here of negative possibilities for them. Higher rate of placement in special ed, not passing that third grade and eighth grade math, grade repetition, school dropout rate increases, teen pregnancy rate increases, low levels of post-high school attainment, higher unemployment rate, lower earnings, and a whole host of issues that come in around violent crimes, time in jail, interactions with the incarceration system, and poor health outcomes. Kindergarten readiness matters. Now, I have a lot of people that come up to me and they say, Angel, it is very complicated and it is very expensive to address issues in those first 5 years of life for a child. And what I say is, let's look at the other side. If we're going to talk about how much it costs, let's think about what the cost to society is for children not being ready. Lives are lost. Dollars have to be spent at a greater rate in K-12, special education, remedial education, dropout recovery, social welfare programs, Medicaid, juvenile justice programs. Those are all costly. Those all have a dollar figure attached to them, and they all have a life that is attached to them. We can also look at the other side for lower rates, lower tax revenue, lower number of people able to fill jobs. So when I have people come to me and they want to talk about the expense of addressing the needs in those first 5 years of life, I have to redirect them to the expense of not doing it. So let's get to the solution here. So Future Ready Columbus, collective impact. We created the Early Childhood Advisory Council, and you can see here on the slide the list of amazing people that joined that council. These are people that are engaged, they're leaders, and they touch a child's life. And we went for those folks that weren't just the usual suspects. Usually when you pull early childhood together, you end up with childcare and Help Me Grow and home visiting. But we took it a step further. MORPC, Mid-Ohio Regional Planning Commission, has an impact on what we do with children. They came to the table willingly, and we were grateful. CODA has never been asked to the table for early childhood. They came willingly. So we ended up with a large number of people. And their very first meeting, our Early Childhood Advisory Council gave us two pieces of, or they actually made two votes on two important things. First of all, they said, In Franklin County, we don't have anybody acting as the backbone and driving that early childhood agenda. So yes, Future Ready, you are not being duplicative, step in, and we also need you to create a plan while you're at it. So we need a plan to get every child ready for kindergarten. Their second vote of that day, both of these unanimous, was that Franklin County must become a trauma to resilience community, because they recognize that trauma is having a devastating impact on our children and our families. So they sent us out and they said, go make this happen. So we did focus groups. We worked with community members. We worked with early childhood advisory council members, and back and forth and back and forth. And we ended up with a plan that was very solid. And in August of 2020, the Early Childhood Advisory Council looked at it and they said, yep, this is great. Now go get more public feedback. So we took it and we had 7 months of garnering public feedback. We did focus groups with over 1,200 individuals, 1 hour focus groups, and we had over 500 people that participated in online questions. We had significant changes to the plan based on their input. That changed and revised plan went in front of our, uh-oh, I should have known I couldn't go backwards. Page up, up. Sorry, everyone. So this revised plan went in front of our board of directors and our early childhood advisory council in August of this past year, 2021. And what they said to us was, this is good, now go implement it. And this is what the Future Ready by 5 plan is that you have here. So one goal, every child ready for kindergarten by 2030. The drivers that are in that are families and communities, health and behavioral health, education and development supports, and public and private infrastructure. With each one of those drivers, there is a number of goals and strategies listed with them, and they all drive towards the outcome of an aligned, equitable, prenatal to through age 5 system that ensures every child is ready for kindergarten. And when we think about the system, there's 4 major components of it. Children have to have the supports that they need. Families and communities have to be focused on early childhood and kindergarten readiness. Franklin County has to have that trauma to resilience component, and anti-racism approaches are used to create equity for all children and the people who touch that child's life. So we have to drive towards a system, and that is our outcome, those components of the system. So how is FR5 different? How is this different from other plans, and why do we think this is even going to work? First of all, this is a plan that was created by the community for the community. We provided support. Future Ready Columbus did not come in and create the plan, dictate the plan, pull it together. We involved many people in the formation of this. Second one is that we have councils that provide direct input and guidance to both our board of directors and to the Future Ready staff. So the Early Childhood Advisory Council, you saw them. We have a council on racial equity, and I loved that Dr. Wade said, if you have a program that does not consider racial equity and structural racism, that program is not going to be effective. So we had created something called the Council on Racial Equity. This council is a group of people who are steeped with experience in addressing racial inequities, who have been doing this work long before the last 3 years when we all first started saying we have to have difficult conversations. They have been doing this for a long time, and their job is to oversee all of those strategies. Every one of those strategies has a leader on it, not Future Ready Columbus, but a leader that has stepped up and said, I will lead this work. And those strategies go in front of the Council on Racial Equity. Now, what we heard from the community was, that's great, wonderful, talk about it, put it in words, but there has to be accountability and this group must have teeth. And so the Council on Racial Equity has veto power and approval power over every strategy that is taking place in Future Ready by 5. Now, this isn't a gotcha piece. They're there to be supportive. And what we've heard from people that are being the strategy leaders, they're saying, thank you. I want to do this work, but I'm not exactly certain how to do it. And I don't want to step in the potholes that previous well-intentioned people have stepped in. So we're getting a lot of great response to that. We also have a data oversight council, and this is making certain that every one of those strategies has an impact metric, that it's not just, I handed out 5,000 widgets. I interacted with 400 people. To what impact? What impact did those 5,000 widgets have on the child, on the family that you're interacting with? And if we can't say what that is, then we shouldn't be doing it. This group is working across all the strategies to make sure that we are telling the story and choosing metrics that are racially appropriate, that are culturally sensitive, and that show impact on what we're looking to move. Next one is that we have the implementation office. So I said, we've got over 30 community leaders who have stepped up and said, I'll own this piece of it. I'll drive this piece of the work. But we have an implementation office that provides the program support for them. So we have those folks that are in there and helping to keep the work moving and going forward on that. I'm watching my time here. So those community leaders are critical to this. So that's why I come back again and I say, this is a plan by the community members, for the community members, and being implemented by the community members. So we have a number of pieces that are in here, and I'm going to get through as many of these as I can, but I have this presentation that's there so you can go through everything else on it. How much time do I have left? 6 minutes, perfect, okay. So with the trauma-related goals and strategies, when we think about health and behavioral health, that number one issue is creating an aligned, culturally sensitive birth through 5 health, development, trauma, and mental health screening system for those folks that are doing non-medical screenings. Some people are very surprised to learn about the large number of people that are not in the medical field that do screenings, and they're required to do so by licensure. They're required to do so by some of their funding streams. And right now, let me tell you, it is the wild, wild west. And so we have just finished a landscape study to understand who is screening, why are they screening, what are they screening, and what happens after that screen takes place. So that is a big piece, and moving it so that we have an aligned, equitable system of screening and moving that to services. When we look at health and behavioral health goal 3, that is transforming Franklin County from a trauma to a resilience community. And what we see in there is, first of all, we have to increase the number of professionals and stakeholders that have the knowledge and resources to address trauma. Remember earlier, what did Dr. Wade say? He said, a caring person that understands how to work with children and trauma can make all of the difference. And we need that in every single one of our professionals that are out there. So we have training, it's called conscious discipline, that is offered, that is being worked through to get that out to every person that is an early childhood professional. And then Family and Children First Council has a number of pieces of training that they are doing to get out. The Childhood League has numbers of training that they are doing to get out. So we want to make certain that we are blanketing our professionals so that they can become that individual that makes a difference in that child's life. We're going to be looking to create and promote a toolkit that identifies all of the available trauma trainings that are out there and the supports, because it can be confusing. If I have my organization, which one do I go to? There's a host of them. So a toolkit with a decision-making matrix there so that I can go in it and look. And you know how we've seen in the magazines, if yes, it goes this way, if no, it goes that way. Same idea that we're talking about here. So you can go through a line of questions and get to the trainings and the resources that you need to use. And the last one is creating a response to intervention approach. So when we think about trauma and we think about all the things that Dr. Wade talked about, response to intervention approach, a triangle. At the bottom, that is prevention. That is where most children's needs will be met. A child's need that's not met goes up to the next level. And that's out of prevention now. That is now at that secondary level. And there are some different resources and approaches to be used with that. A child whose needs are not met there can be elevated to the top. And that is the most intensive services that are there and available. And it is the one that we are seeing backups, waiting lists on. And the problem is because we don't have this approach in place, we have children when well, first of all, we don't have much in the prevention, but when prevention doesn't meet their needs, they're getting elevated to the top, and triage is happening at the top of the pyramid. That's not where triage needs to happen. Now we've got a wait list. Triage needs to be happening down lower. And so that is what we are looking at when we're talking about creating this response to intervention approach. When we are looking at our education and developmental services, we have to increase access to and utilization of those high quality supports. And we have to make sure that every early childhood approach and professional has implicit bias training, demonstrates cultural competence and cultural humility. If a person is working in the profession and they are not trained and able to identify and work within their areas, they can cause more harm in the form of an ACEs to a child, and that we can't have. Last one is infrastructure, and we are going to be creating a data warehouse that will have information. We are going to have a outreach campaign that is going to be looking to remove barriers, eliminate stigma, and educate. And then here you can see the last part on there under infrastructure is our Council on Racial Equity. So what I would ask you is to get involved. There are a whole host of strategies. You can go to the website and see what all of them are. Every one of you is here because you either interact with a family or a child. We are going to be looking to use every touch point that we have with a child in the birth through 6 area to bring in partners who work with the parents, that work with the adults. We will be using the touch points of early childhood to elevate the work of our partners who are working with the adults in that child's life. So please, we need you all involved. You can go to our website to sign up for our newsletter, express participating in those, share the Future Ready website, follow us on social media. This is kicking off. We have got several strategies that are already up and running, and we really look forward to having many more partners engaged with us in this work. Thank you. Please. We are a public-private, so we have numerous folks that are in the private realm that donate in. We also have city and county dollars that come to us. So we really try to keep our funding at about a 50-50 mix.
I could thank Dr. Rhodes and Sister Francis for presenting this morning. We are going to go ahead and break for our lunch. Lunch is until 1 p.m. It is being served in room 214 where you got your breakfast. And for our virtual participants, we will return to activities at 1 p.m.